When we were taking a look at a CRM to start to bring the sales team together, some of the key factors that we were most interested in were how easily we could assimilate and actually install our people into the program. And we didn't want this laborious task. I'd looked at some other CRMs before with other businesses, and it was months and months of processing up front and cleaning data and creating different databases, and it was way too much work to have to go into it for the size of our organization, and really couldn't determine that there was real value with that because it would take us so long to get there. When looking at PlayMaker, the ability to go onto the PlayMaker platform, integrated into our organization, into our operations, get our salespeople up and running on it, was a much shorter window. And the work was, it was PlayMaker who said, let us help you to do this. This is what we can do for you, versus having a vendor say, here's what you need to do, and here's all the work you need to do so that you can use my product. And that was the real difference from an assimilation standpoint. The closing factor for us, for PlayMaker, was that it was made by home care people for home care people. And they understood what it is that we needed, and they understood the value and the need to be able to do the relationship mapping for our contacts, knowing that we're not business to business, we're people to people, and people move. That's what was key for us. The way PlayMaker provides us a competitive edge, it's really clear to see it once you're involved in PlayMaker and once you're in the system. First off, the incredible data that we can get to. With the Target Watch feature, now our reps can quickly be outside of a physician's office that they haven't called on before and at least have the very basic intelligence to know what's taking place, where's the business currently going, what kind of volume do they have, what kind of patients are they serving, and it's credible data. It's not our own market intelligence, but it's really driven through Medicare. So it is good, clean, understandable, easy to access data. That gives us an absolute competitive edge. The other aspect that gives us a competitive edge over the people in our marketplace, because really we have no one else who's on a CRM in our marketplace. The other competitive edge that it gives us is the ability for our reps as well as our clinical liaisons to really know which doctors are referring, when they're referring, and it leads us to be able to get into our own EMR and understand and drill down on the patient so we can actually be able to provide patient relevant information. And it gives us that, it gives our referral sources that sense that we at Aspire are all coordinated, all the way from our home health aides up to our sales reps and our clinical liaisons. So both in the patient's home and out of the patient's home, we have got information and we're coordinated, and that brings real value back to our referral sources. If we were to try to rewind the tape and think of a time that we didn't have PlayMaker in our agency, there would be some real gaps that we would see. One, we wouldn't have the kind of critical thinking that we have today. PlayMaker has caused us to look at our own business and look at our referral sources in a whole different way. And we are now much more confident because we know we have credible data that is accurate, that we can go back to our referral sources with and back with our physicians with to report back about our patients. I think if PlayMaker were to be taken out of an environment today, we would see a drop not only in our referrals, but we see a drop in our morale, because now we would have reps who didn't have that kind of information, didn't have the confidence, and were scrambling to try to come up with information. And I think we would very quickly slide back to where we were, to be fearful of going into some physicians' offices and continuing to go to those places that we've always gone to and getting the number of referrals we've always gotten, and our growth would actually stop.